So we're live and we're going coast to coast right here. Everyone, I wanted to introduce myself as we're coming along. We got 220 participants right this second. We have over 400 registered. We'll see how far we get. I wanted to formally thank the CPA. I'm Physio Kareem, the private practice chair of the private practice division. And I wanted to thank the CPA for inviting us to do a little takeover party for this webinar in this COVID crisis. Today, we're so excited. We're going coast to coast. We've invited 4 amazing panelists to share the screen with you guys. Without further ado, I'm going to go from the East Coast to the West Coast. Nicole Sullivan from Men's Physio on the top. We got Daryl Yardley from Mentorship Bootcamp. We got the Titan of Titans, Wendy Coons from Momentum Health in Alberta, and the Styling King, Vinny Kinnan from Sun City, Kelowna. Welcome, guys. Thank you. Yeah, thank you, guys. So, guys, I just want to give you guys a little, or everyone that's watching right now, a little sort of like rundown of what we're going to do, man. This is a huge crisis. You know, I've been on all the channels on Instagram, on WhatsApp. I've been listening to the chat. I've been amazed at how everybody's been working together and they're, you know, helping each other through clinic decisions, in terms of employment decisions, strategies. Everyone's working together. This is what we all need to do. But today, the format of this is how do we work together as one voice and move the profession forward. So what we're going to do is we're going to go from East Coast all the way to West Coast, and we're going to figure out what's happening from one side of the ocean to the other, and then we're going to talk about strategies of what to do, whether your clinic is open, whether your clinic is closed, and then we're going to go over to Daryl. We're going to talk about if you're a clinician, what do you do if you're on this side of the screen or if you're in front of your patient to get that therapeutic alliance and keep it going. So without further ado, Nicole Sullivan from Men's Physio, our Ontario rep. Give us a little bit about yourself and tell us what is going on the East Coast of Canada.
I don't know if I represent the whole East Coast, but Men's Physio, my business partner Candice Wong and we have a clinic in Leslieville and near downtown Toronto, and we've been closed. We decided to close on Sunday, so all of our staff had a meeting on Sunday. We had a conversation just about, you know, city, country-wide safety and the feelings of just sort of how our group was feeling and how
Ooh, power technology.
Like hoping that people in our community would follow. Oh.
Looks like we're catching out a little bit here. We got you a little bit in there. So I think we got cut off a little bit there. I know for a fact that you were one of those first trailblazers to make the decision to close your clinic in Ontario. And I know there's a big wave in Ontario of clinics closing down. Nicole, tell us, take us through, what was the decision-making process? Because obviously there's been a wave in Ontario of these clinics closing down. What was the deciding factor? Because you did this before the college, before any of the associations were doing this. What was your thought process?
Can you hear me? I just want to make sure.
Yeah, I can hear you loud and clear.
Good?
Yeah.
Oh, we can. Okay. We had a staff meeting on Sunday, and we just talked to everybody about, you know, what was going on, what the lessons we saw from overseas, and we have friends and family that are working in hospitals and on the front line. And I think going to McMaster and primary care and community care, just staying in my head, Candice Wong and I, my business partner, it took a second. We talked to each other, we talked to our staff, and we're like, let's do this. We have to close, and we have to see if we can use good leadership and make a positive change for our community and see if whatever we can do to help. If this is the only way that we can help, this is what we're going to try and do. Did that work?
Awesome. Yeah. So how did you, like, what for some of these clinics? Would you say that in Ontario, is that true that there's a big wave of clinics closing? Are they staying open? What's happening in Ontario?
I think for the most part, and Daryl, you can chime in here, I think most clinics seem to have closed or are closing at this point. I think some of the larger clinics may have not closed yet, but just based on a lot of conversations with clinic owners and also clinicians over Monday and Tuesday. And I think a majority of the people that I know decided to shut their clinics down.
Gotcha. And so before we switch over to Daryl for a second, you got a lot of social flack initially from closing. Tell me about that. You know, was you know, being a trailblazer, putting yourself out there, was that a big part of the decision? Did you regret that, closing that clinic down?
100% no regrets. I would say we didn't get slack. We more just got a lot of people asking, like, why did we decide to do this? Was it a hard decision?
Gotcha.
And what are we
Gotcha.
afraid of the repercussions
Right.
of closing? So I think we got a lot more support than anything else. And people that aren't even in the physio business in our community, almost all of Leslieville actually closed down within 24, 48 hours of us closing too.
How difficult was it for that first conversation with your staff about closing the clinic in lieu of social responsibility?
Were you just, sorry, I didn't hear you the whole way. Did you just say how difficult was it to make the decision?
Yeah, to break that news to your staff. Like, what was your conversation with your staff? To, like, how did you approach that?
Actually, our staff all had a conversation together, and that just helped us to talk before. I actually got to talk to Candace right after we had our meeting, and within half an hour, we already decided. So our staff kind of decided together. Everybody, you know, we really consider our family like community in our clinic to be a big driver for our success. So fine.
Awesome. That was awesome. So Daryl, I'm just gonna switch it over. What's happening in the on the sort of rural side? You know, you're a clinic owner, as well as a mentor to lots of clinicians out in Ontario. Can you tell us what's happening on the rural side of, or outside the GTA? What's going on in Ontario, the rest of Ontario, in terms of the clinics?
Yeah, so it's good. Thanks for sharing that, Nicole. I think the challenge that we've seen actually facing in the GTA is the fact that so many buildings were actually told, like, employees were told to go home, right, work from home. So it actually took so many people around the downtown core, which is really tough for a lot of clinics that were in the GTA, or especially downtown. For us, sort of on the outskirts, we actually, to be honest, at first we saw an influx of actually new patients coming through our door initially, because quite a few patients were now home. But what we've seen as a sort of a little bit of a trend lately is individuals are now, especially with a lot of the recommendations that have been coming out based on the government as well as the association and the college, was we're seeing people suspend inpatient or face-to-face care. So for us, our clinic right now, we're still open. We've suspended inpatient care unless you meet our urgent criteria or what we would consider an acute case, because we still, at that point, we're trying to balance what's our social responsibility versus what's our role as essential healthcare providers. So we've gone down to a very, very skeleton staff in order to deliver care to urgent cases. And everything else is still open related to when we're offering virtual consults, and we're even just doing phone consults, which is just check in order for us to maintain our active patient list and still be able to accommodate individuals that are seeking care from our services, even though we may not be able to see them face to face until we're safe to reopen for in-person contact if they don't meet an urgent criteria.
Yeah, so how did you guys decide on, if people are trying to do the skeleton model, how did you guys decide who stays, who goes, and who runs this teleportal?
Yeah, so that's sort of been for sure the harder decisions to make. But really, as an owner perspective, it was a matter of looking at who actually holds the most essential role into the clinic. And when we're looking at a lot of the service delivery that we were doing at the time, majority of that fell to our clicians. So right now, our skeleton staff right now is our PT, as one of our PTs, and the other components of our staff they've all gone home. But again, we also had to take into account who had at-risk family at home and things like that. So we actually had a really good supportive discussion with our team. And very similar to Nicole, I was beyond impressed with how supportive our team was, but also how much they actually, envied us for the type of decision that we actually had to make. So I'm really just overall impressed with just how supportive the whole system has been overall, and even our patients at the same point in time. They've been converting actually quite well to say, yeah, I'm happy to see you guys virtually, as opposed to having to come in just to do our social responsibility.
All right, we're going to touch a little bit more on tele-rehab towards the end. That's a hot topic in terms of what kind of strategy that you're looking for. But I want to move over, thanks Daryl, I want to move over to our private practice queen, Wendy Coombs, Momentum Health. This lady, for everyone who doesn't know her, had built an empire, sold it, and then built an even bigger empire in the economic downturn. How she did it, I don't know, but she's
okay,
bigger,
we're gonna just cut
better.
Grim off right there. We
This is so true. This is true.
We
Former
do have,
PBD chair.
You're awesome, thank you. But we have 12 clinics currently in Calgary. We are primarily physiotherapy owned, but we also have sport med clinics and clinics with physiatrists as well. So we do have about 12 different disciplines. So what we're seeing in Alberta right now, I mean, obviously, CBI and LifeMark, from what I understand, have closed. Maybe some of them are managing WCB only. So that was kind of the first words we were getting about clinics actually closing in Alberta. Another larger group of clinics have closed. But we're really doing a transitionary model and really assessing literally twice a day how we are going to manage this, because one decision for us affects 200 people. And our payroll is $1 million a month pretty much right now. And for us to make a decision that impacts, $500,000 of contractor payroll and $500,000 of employee payroll a month, it has far reaching. The first thing we did was absolute stringent standards of practice around infection, cross-contamination through obviously the obvious list of things, but everything from removing magazines in the waiting room, right, to ensuring we have enough masks and going on and on. So I know you guys know all that. We can talk about that later if there's time, but we do I call them war room. We don't call them war room meetings, but basically twice a day, 8 a.m. and 3:30 p.m. We do a 1 to 2 hour meeting, and people just drop in when they're, and this is partners, owner partners, physiotherapists, they drop in when they're outside of clinical, and our core management team is there just to answer any questions that come up and make decisions. So initially, we were seeing patients drop. So Monday, our caseloads dropped 30%. Today, they're close to 40 to 50% drop in patients. So the first message we set across is that we absolutely need to match staffing to patient caseload. So we went and we offered people that were uncomfortable coming in, that wanted to take time off, we offered them voluntary layoffs so they could access EI. And that was our first way to manage without actually doing any formal layoffs. And we were able to match the message we sent out. Primarily, our number one reason was that we wanted to decrease cross-contamination in the clinic and be able to practice social distancing. So with the removal of waiting room chairs, removal of spacing with bed, plants, and patients, and the natural drop in clinical caseload, we were able to practice social distancing, and then by decreasing. So anytime clinicians, contractors didn't have patients, they were asked to leave the clinic, once the day was over and there wasn't any more patients coming in. We're still ongoing trying to decrease any extra bodies in the clinical area. As things progressed, it feels like it's been a year since Monday, but what we've had to do is increase the urgency around who we're seeing. So we are just transitioning into identifying patients that are acute and urgent, like we were hearing Daryl saying. So I like, you were calling it the hybrid model, Karim, and I think that's where we're going.
So I got a quick question, and this came up in the Q&As. And Wendy, I'll start with you with the answer, and then we'll go to Daryl, because that was the question that was asked. Is what do you guys determine what urgent is between the two of you guys? You guys both mentioned urgent. So how is someone deemed urgent? If that's the model, if someone's going to do a hybrid model where the clinic is open, and there's a skeleton crew, they're treating urgent only, essential care. Tell me, Wendy, how did you guys determine that?
Basically, we're still determining that. We haven't actually put that message out. I'm working on that message tonight for tomorrow morning's 8 a.m. But ultimately, we're going to go with self-identification. So we are not going to be calling patients. We are very aggressively screening every patient coming in. We are asking all the COVID-19 questions prior. It's in our e-reminders. It's in the poster on the door. So we're screening them for high risk, all of those pieces, and then letting them know our next messaging is we are open for high priority urgent cases, and we're letting them self-identify. My example that's a little bit weak was, ultimately, what if you have a really acute sprained ankle and you have an immobile parent? All of our kids have just been given the entire year off school, and I have my children at home, and they're outside doing, ice bucket challenges in their shorts and doing silly things, and I have no ability to watch them because I'm working. And we're going to start to see, injuries where people just need to be mobile. They need, and how are we to determine what is urgent? It's really up to the individual. Patients are self-selecting right now. It's really only the ones coming in that really need to see us that we're seeing. And like I said, it's, obviously that's a different screen for our sport med physicians as it is, but, and each discipline, we have a lot of other disciplines in our province are being advised to close, but the number one message that we are saying and we are sticking to is we are following our college, physio and chiro and physician college recommendations on clinic closure. And we are following our city, provincial, obviously federal mandated initiatives. And that is how we're basing our decision. We are not making decisions beyond that so that we can stay consistent with what our health services deem is important for the services that we're providing. A lot of our clinicians are getting confused. They're seeing, all non-essential business should be closed. They're talking about restaurants, they're talking about coffee shops where people are gathering. They're not talking about medical services and differentiating between, right? So that's how we're reviewing things.
And I think, this is a totally different webinar, and it's something that physical therapists need to have their own discussion with themselves and the profession themselves is, do we value ourselves as essential care providers? There's a lot of talk. It's very controversial right now whether ibuprofen can actually increase the susceptibility or the intensity of the COVID-19, whether you're going to acquire it or not. Apparently there's some receptors. It's still very early and controversial about that. Those patients that aren't being seen are taking more pain relievers, more of these anti-inflammatories, altering their clinical presentation, maybe coming around, walking around society with no fever, but fully viral, right? So that, us treating them could alter even the spread in itself. But thinking about us as a profession, we've worked so hard to put our profession forward as primary care providers. So that's a whole different discussion. But I wanted to ask Daryl about this self-selection of urgent, because I want to bounce back to the voluntary layoffs. I know that's a question that people have been asking, but I'm going to keep it towards the end because I want to get to Vinny, because I've been talking to this guy and he's been deciding. This is like love it or list it. We're going to find out what happened with this guy. But Daryl, tell us about how do you select this urgent caseload?
Yeah, so I very much like Wendy did. We actually were just observing for the first couple of days as we were actually in, the decision-making process. What are we going to do as a clinic? But right now, what we decided, looking at our caseload specifically, is what our acute criteria, our urgent criteria are. Is if someone comes in with an acute injury, that for us, that's what we're utilizing, because we may not be able to advise it, through virtual rehab unless I actually assess that to obviously make sure they're even safe. Because as Wendy said, an acute ankle sprain could be a fracture. Like, that's our expertise, right? And what our focus was on that is we don't really want individuals flooding to the ER if they don't have to go there, because the reality is right now, just coming out of a hospital contract as an executive, there's no capacity right now because they're dealing with the other crisis which is there. So that was one piece that we were concerned about. The other piece for us is we see a large post-op population. I had a post-op surgical case that was operated on Friday. They can't wait for me to do it. I can't do it through virtual. So we need to see those patients just to get them started on their care plan. And the one that was the hardest part for us, which is what Wendy talked about around the self-selection piece, any patient that we thought was at risk of high deterioration that may not be able to go back to work or something to that look after their families, we will actually screen those people, obviously, for the appropriate screening and surveillance that we must all do based on public health recommendations. But that's another group that we've been working with. And I posted those in the chat too. But remember, that's kind of our caseload specific. So I don't treat a neuro population or anything like that. So for those individuals out in the community, that's much more complex than what I would see as far as my decision making goes, where individuals are coming into their private home care practice.
The other thing too is canceling group, anything group. So all of our group programming is done. We've shut that down.
Okay. So before we get into it further, I want to give respect to our West Coast connection, Vinny. Man,
almost
so
West
excited.
Coast.
I'm almost excited. So excited. Kelowna's West Coast, man. Anything past Calgary, where I'm at, is West Coast. So it's, tell us, when I first talked to you, you guys were in the mix of stay open, stay closed. Where are you at? Make the official announcement.
Yeah, so we at Sun City Physiotherapy in Kelowna are closed, actually, as of today. And it's really interesting to see everyone here sort of coast to coast, people that I know, Halifax to Vancouver, and everyone in between, and even some local clinic owners that I know. It was a tough decision. We have 4 clinics in Kelowna, and after 20 years of operation, we've never seen something like this. So we met. Social media is a funny thing because I'm on it all the time, and Ontario and BC are the hotbeds for this in Canada. So I wanted to just sort of continue to stay 3 steps ahead, and to make sure that we were making the right decisions. And so, I would actually credit you, Nicole, because I think you were the first post that I saw over the weekend about closing. And mid last week, it was interesting because some of the physios were concerned about people canceling because naturally you have some fear there. But interestingly, statistics showed that we were actually 30% up in our intake before the end of the week. But I followed it quite closely through the weekend, and I was just kind of discussing it with the partnership, and we cautiously stayed open Monday, and I stayed open Tuesday, and then we decided to fully close all of our offices today. And difficult decisions to make because we have over 20 physios and 7 or 8 RMTs plus a lot of staff. And so first and foremost, we're not thinking of ourselves, we're thinking of others and their families. And for me, it's also embedded a little bit of an emotional decision because I have an immunocompromised family member at home. And so it's not the risk of me getting it, right? It's the transmission. Mm-hmm. And so with BC and Kelowna being quite a very close-knit community of 120, 180,000 people, we're out and about, we're outdoors all the time and in big groups, and we love to support local businesses and communities. So up until I think before they banned non-essential groupings and before they declared that the province in a state of emergency, people were still respectfully respecting the social distancing parameters, but it wasn't really stopping people from getting together. So that I think was good, but my paranoia was like, maybe we're being a little bit too nonchalant about it. And so again, met with the other partners, and we made the tough decision to go ahead.
That's deep, man. That's seriously deep. Tell me, how did you break that? I asked the same question, Nicole. What did you say to the staff? Obviously this is fresh. It's in there. So tell me,
so
how did you approach staff?
We had four clinics, and so as managers, owners of our each individual clinics, we wanted to meet with our individual team. We have an awesome client care team that communicates all the time, and sort of upper level managers that communicate with them. So it was about a constant state of communication for us. And then we're also, as I see some clinic owners from Kelowna in this room, we're just kind of getting the pulse of who was doing what. And again, it was amazing because I think we wanted to sort of present as a united front as well to close sort of all together, or kind of subsequently one after the other in proximity. But we wanted to roll information to our individual teams first, and then come together to create a united message. And then before we posted out anything to, say, social media or in our newsletter or big mass emails, we wanted to make sure that the messaging was clear going forward. And I echo some of everyone's sentiments here on the forum panel, that it was trying to figure out how to determine who was going to be urgent care, because in our messaging, we're essentially saying we're rebooking everyone through to March 30th. And part of what we wanted to do also as a business practice was retain, because we didn't want to come in March 30th and have an empty book. So that was sort of number one from a business perspective. And then figuring out the rollout of what to do next with our client care team, and then the practitioners. And so day by day, it's changing. And even with the information that Prime Minister Trudeau rolled out today with respect to the potential relief, like we're going to have to discuss that now, because that plan is certainly different from what our original plan would have been for our salaried staff. And in terms of going forward, we're suspending in-person physical therapy care. We also have kinesiology. We run dietitian programs and RMT, but we're offering telehealth strategies, as well as figuring out a way to probably keep one clinic open with one manager and one practitioner, whether that be on a rotation basis or not. But someone is going to be there to answer the phone, to listen to a voicemail message, and to be another supportive person, practitioner, to provide that urgent care support.
Okay, so we're looking at a hybrid model here. One of the key things that I wanted to ask all the panelists right here, I want to jump, Vinny, just because we heard from Nicole at the beginning. I want to just see how this came through, because we talked about voluntary layoffs. And before Vinny, you tell me what you did, I just want to swing over to Nicole. Nicole, did you guys do voluntary layoffs, or how did you handle your, because you went from, I'm assuming you went to a complete closed clinic, no one's there? Are you answering the calls?
Our admin staff are working. No, our admin staff is working. Yeah, we're working remotely, so they're still getting paid their salary, and they're rotating when they're each. answering emails and like working remotely to check the phone messages, and we are paying them for their time, just like as if they were in the clinic. And that's just what Candace and I agreed on and feel right about. I mean, obviously with the Prime Minister messaging today that there is some relief, there is some help there, but those are our most vulnerable people in the clinic in terms of like relying on, you know, their employees. And so our other staff, the physios, have a way now, hopefully through telehealth, to make up some income. And for our RMTs, hopefully with the Prime Minister's messaging as well today, can do that. So we went full, everyone is a contractor except for the admin staff, and the admin staff, we continue to pay them.
Gotcha. It's the contractors. All right, Daryl, what'd you do in your clinic in terms of the voluntary layoffs? Kept them on, paid them on. What can you share with us?
Yeah, we did a layoff, and then we issued ROEs so they could collect EI. All of our staff are employees.
Fantastic. Wendy, you've got like behemoth of a clinic. What did you do with these $1 million payroll?
Well, it's just a lot of people was my point. It's a tough decision because we have really different cultures. Each clinic feels differently about things, and yet we want consistency in not being part of cross-contamination. So ultimately, what we initially did was that we didn't do mandatory layoff or voluntary layoff. It was voluntary, but we did the temporary layoff where basically they're off for a week, which a lot of them wanted. I mean, we're all talking, oh, the clinic's completely closed, but we still have staff working. So, and is it only closed for 2 weeks? I see this as, I'm on boards for primary care networks in Alberta. I'm hearing what the physicians are saying. This isn't going away in 2 weeks. Canada's strategy is to flatten the curve, which means slowly managing people that are getting sick so that we can handle it in our ER departments, which they're saying is about probably 10% of the population needing to access that. So closing for 2 weeks is going to flatten the curve in the immediate, but are we going to have to stay closed or reduce staff for prolonged periods, which has been our concern, is how sustainable are we as a business? Are we even going to have a business to open and bring people back to? The longer this goes, the less likely that all of our clinics will open. We have completely shut down one clinic that may not open financially. It was in a startup mode, right? And with very small staff. And, you know, at what point are you saying, you know, I can't make the math work on our financials? So by doing the temporary layoff with the week, they have the ability, it's 60 days off or over 120 days, but they have to be off that first week. Then you can have them come back on some modified, they have to submit to EI, but allows some staff to come back if you do need to increase or whatever, or you end up having staff that now you know, have to go look after a family member, have to look after childcare, and you need to bring other staff in. So it just created that flexibility. And then we have people that are just like, no, I don't want to go. I just want to be on reduced shifts. All of our massage therapists, for the most part, are off now because of their association recommendations in Alberta. And so, I mean, it really is individual. So we have more clinics where physiotherapists are like, I'm autoimmune compromised. I don't want to be here. And all of those people are off. So, and some of them want to go on temporary layoff, some don't.
Okay. Vinny, before I'm going to get Vinny's thing, I got one quick, a really interesting question for all of you panelists here. It's one from my old boss, my first boss, Bonnie O'Hara. We're coming to you in a second. Vinny, tell me what you did with that.
It's pretty fresh right now for us, but it's looking like we're working towards the same model as Daryl. We've got some managers just finishing up some AR and billing, and since we're going to be rolling with the telehealth, there's going to be someone working. So we don't fully quite know how it's going to roll yet. And in fact, we're probably going to need to be meeting here quickly to make some decisions so that our client care team and managers know.
Okay, Vinny. Wendy, I'm going to bounce back to you for a second. This is a technical question here. Since you're a guru at this employment contract, is if you have someone on EI or you've laid them off, who's been laid off, can they still talk to patients like through telehealth? Like if you've laid them off, right, and they're employee physios, can they still talk to patients outside of the practice now that they're laid off?
So what we're doing, because we are rolling out telehealth too, and right now it's the clinicians that are in the clinic that are launching telehealth. That being said, we may get to the point where we are mandated and we're closed. College, we're following that. So we may then have to bring everything into telehealth. And so what the plan is now is the EI piece of an employee layoff is such that if they work and they make money, they just submit that income through EI and it offsets the EI portion of their payment. So once you're over that week, there is ability to generate some hours, just kind of like how an EI mat leave would work a bit. Now, there is a lot of really cool things the government's doing for self-employed people, contractors. So all of our physio contractors will be able to apply through the CRA for some income subsidy there. And so, I mean, we don't know really what the qualifications are, just that's going to be happening. I believe it's around April 1st. So it makes me very relieved that the government is going to be helping those that actually don't have access to income. But that being said, it would be the same thing where our contractors would be managing telehealth. Those would be still going through our clinic. They would not be doing telehealth separate and billing separately for that. It would still be going through our clinic management software, etc.
Yep.
So one last quick question. Did you guys do anything, sorry, Daryl.
That's okay, go ahead.
Did you guys do anything for employees that didn't qualify for EI or a new employee? Is there any strategies that you can offer clinic owners that if they have employees that don't qualify for EI or the new employees, you send them home with a gift card? Like
they've waived the 90-day working for an employer criteria. They've waived the 1 week waiting period. You can get EI right now if you are caring for a sick individual and not even sick yourself. Right now, the way it's worded, again, I'm a physio. I am not in HR. I do not run my HR. I have an awesome manager that does it. So please verify everything I'm saying. But from what I understand, that to qualify, you don't need a doctor's note, and it's self-reported, and they waive the 1 week waiting period. So it's pretty easy to access.
Yeah, and I would just say with Wendy is the same thing. So there's actually some EI wording going through the Government of Canada website versus standard EI versus EI related to COVID. So just make sure you're actually referencing the right stuff, because as Wendy said, a lot of these waves have actually occurred, and that's actually what we've been leveraging in order to make sure we can support our staff as best as we can. And remember, everybody, there was a big announcement this morning around another relief fund that's for our self-employed staff, so all of our contractors, and probably many of us on the phone as well, who are owners who are not actually getting paid as well. And at the same point, though, there's supposed to be, just rumor has it, there's another relief announcement coming out tomorrow, so stay tuned for that from the government.
So I'm just trying to be mindful of time here. A super, super hot topic, guys, is telehealth, telerehab. This is like hotter than Instagram right now. People are all over this. And I got my Nicole. You mentioned you guys are doing telehealth. Are you guys in on it? Nicole.
Oh, there she is.
Yeah, we're training. We're training this week. We're working it out together. We're practicing, and we want to make it good. We don't want to rush to it. So we're.
Gotcha. What was your platform that you selected?
Right now we're looking at a few, but we use Jane, so we were playing with PhysiTrack most recently, and we're going to check out Physio, and Bodia just announced today that they're going to have a solution too, so we're going to play with them before the weekend.
Perfect. Wendy?
Zoom.
You guys are Zoom Health?
Yeah,
now,
so
go on.
no, I was just going to say, from what I know, I mean, we're just getting started too. Zoom is our platform because we're not on Jane.
Gotcha. So you guys are already doing consults as we speak?
Say that again?
Are you guys doing consultations already?
Just getting started. No, probably tomorrow.
Okay. Wendy, did you cough into your elbow?
Yeah, I did.
Okay, good. Just checking.
I've been talking since 5 a.m. I'm losing my voice.
It's a quick movement. Daryl, you've mentioned, this is a hot topic, man. You've been mentioning how you guys have been doing this already. Hot topic, man. Are you charging for this or what?
Yeah. So I've been using Telerehab for over a year now. And again, my practice is slightly different than probably most, but yeah, I charge the same price. And I look at it, I know a lot of clinicians will struggle around, well, I'm not actually touching my patients, so how can I bill for that? But again, when I look at a lot of what I do as a physio, is part of it's my hands, but a lot of it is my brain. And a lot of individuals, when you ask the patients, a lot of people have actually, when we offer them a virtual consult, they were actually so excited by it, because a lot of what we do brings a lot of value, but I think it requires a lot of us as physios to believe in that worth that we have with education, reassurance, exercise, supervision, all those things. And one of the things that I told Grim I would say today on the phone is, as a manipulative therapist myself, I would see a patient once, maybe twice a week. My manual therapy is potentially 15 minutes, and there's 7,000 minutes in a 7-day work week that they're awake. So for me, when I look at that, I struggle when I have my own blocker. So that's how I became over my objection. So we certainly have criteria, but I believe in the value that I'm bringing across to my patients, and I'm not going to devalue the service. And again, I meet all the college guidelines. We've followed everything. There's so many position statements out there right now from every province, every regulatory body across the country, and just make sure you stick to those. And really for me, I'm just a firm believer in what I'm able to provide. And just something else to share, there's many non-regulated health professionals that are just blowing up in the space, and that could become some of our biggest competitors very soon.
Gotcha. And then Vinny, what are you guys looking at right now?
Yeah, we use Jane as our EMR platform, and we did look into the billing strategies around it as well. So our insurance provider here for motor vehicle accident is ICBC, and both ICBC and WorkSafe BC are going to be rolling out their considerations for billing, actually, I believe by the end of this week. So regardless, from a sort of a continual continuity of care, we've all offered our own Sun City email addresses to each of our clients, and we've made ourselves available from a distance, whether it's through email or through video conferencing through Jane, whether it's billable or not.
So I'm going to put my own spin on this, as my forte is independent contracting, and when I look at there's this debate on whether telerehab is going to be able to get extended healthcare coverage or not. I know Daryl and I have had spirited discussions on telerehab as a tool to assist in the therapeutic alliance, right? And so what I look at is, if anyone's going to be having to close, is looking at that telerehab as your link to ensure that your caseload is going to be there 2 weeks from now, which is another topic in itself in terms of using telerehab as a retention tool. But I do want to get to one thing that is lying through the whole Q&A here, guys. Is there something that the public knows that we don't, or the government knows? Why are we looking at April 1st as COVID-19 going away? Wendy Coombs, you had talked about how your understanding with AHS. Is it April Fool's Day? Are we the fools? April 1st, is COVID going away? Like, what do we do when we close? We've been socially responsible, close the clinics. We're doing that. We're flattening the curve. April 1st, who's going to be the fool? Tell us.
Well, I am definitely not the expert on this disease, but basically what I'm hearing is, we are not China, Italy, or even the UK strategy where they're letting this COVID go through the population and managing the other side of it. And we are trying to slow transmission, which means it's going to be a longer process. I don't see that the government is going to keep us in a state of emergency. I can't imagine that we would, where they're recommending so many businesses shut down, and but it's just unprecedented, so we don't know. So that's what I'm thinking. It's really good business practice you have to have a contingency plan. So if we do need to be on the hybrid model, only seeing acute urgent patients, what happens after 2 weeks? We have to be planning that now, planning it ahead, because I don't think that it's like we're all back in full swing April 1, and so we have to plan. And I'm advised, I would recommend talk to your landlords about rent deferral, reduced rent. I've had mixed feedback from our 9 landlords, and I would suggest cutting all. If there are any extra expenses right now, that don't cut medical benefits, that would be bad. But if there's anything a little bit extra that you might be doing that you can eliminate in the short term to manage your expenses. And our staffing cost tends to be 70%, 60 to 70%, and sometimes higher of our revenue. And so what happens with that is that it is managing the staffing costs. And then also, if you do have bank financing, talking to your bank about going to an interest-only payment and deferring your principal payments, they will do that. Or some banks are looking at extending your line of credit, and that can buy you increase your runway financially to be able to be off longer. But many of those strategies, of course, mean that you're going to have to make those expenses up. Finances are a lower priority to keeping our society healthy and alive through this, our seniors alive. But it is our responsibility as clinic owners, as we do support the livelihood of many people, to have that plan in place as well.
Perfect. Daryl, you, as another side hustle, you're a consultant on the Clinic Accelerator program that advises a whole bunch of clinic owners. What's the number one tip if a clinic is in this situation that you could share with us that you can help guide sort of a rebuild April 1st plan? What's an April 1st plan for us, the private practice community, and I think if you're an individual contractor clinician, you got to listen up, because you got to treat your caseload just like a clinic. So Daryl Yardley, tell us that.
Yeah, so I think from what to do as an owner perspective, Wendy nailed it, right? Like, you've got to be able to control your expenses. And in my mind, I look at that's not necessarily a defense strategy. Defense strategy is when you're not thinking about that and you're just waiting for everything to kind of fix itself. So, that's the first strategy of going on offense. And for me, is I actually don't think there is, wait till April 1st. Like, we need to be managing our active patient list like now. And it kind of goes back to Bonnie's question earlier too. So, Wendy gave some good examples. So if you're an employer independent contractor, you own that caseload. And right now we have a barrier in front of us where we have restrictions from a social responsibility where I can't touch or be in person unless, like we talked about, the urgent cases. And that's our sort of duty to serve. But it's our duty to serve all of our patients and people who actually need our services moving forward and actually are seeking help and service. So right now for me is touch bases with patients and looking at your active patient list is a critical step. And one of the things that resonated so well with me, I was on, I think it was on Twitter a few days ago, and Sharon Dunn, who's the APTA president of the Physio Association in the States, her biggest thing, and I'll kind of quote her, is, engage and look at utilizing virtual rehab. And unfortunately, we know that some insurance will cover it and others may not. And her whole point was, it's okay to do shit for free. It's about how we do our duty to serve. And for me, if you focus on your active patient list as an owner, as an independent practitioner, you have something to come back to. Because what's going to be very difficult for us as clinic owners is when we do or have the ability to go from shortened schedules, we can start to add days, we can start to add hours. We have to make sure there's patients to be there in order for us to get back in service. We can get people back to work as quick as possible. And the best way to do that is to stay in contact with your staff, with your patients.
Perfect. Nicole, on the East Coast, what's your number one tip for Ontario physios in that predicament to bulletproof from April 1st? What's your strategy? What are you guys doing at Mend to mend the soul from being awakening guys?
We're staying in touch with each other every day. Our clinicians are staying united, and we're staying in touch with our patients. So that's all. That's our tip, is like, stay in touch. Don't let the patients go away. You know, let them know that the reason we did it was in their best interest and our clients' best interest as well. And we're here, and we're just pivoting right now so that we can stay with them and keep helping them.
Perfect. Thank you. Vinny, soul to soul, man. Tell me, what are you guys doing? You gave all your emails. What are you doing? What are you doing to both for April 1st?
I should almost flip the question and ask you if you think it's going to extend beyond April 1st or not. But for me,
I think. Yeah.
For me and our team, I would echo everyone's sentiment, especially Nicole's. Like, keep communicating with our team to keep them aware. There's nothing more that's probably a little bit annoying if they're out of the loop. And yeah, I think already we've got sort of the pulse high to ensure that we're still looking at our schedules. And even though they've been formally rebooked to a later date, they're still noted in our schedules for us as a reminder over the next coming days till April 1st or March 30th, or however long you've extended your closure for, so that we're still actually actively working and engaged with those patients and clients. But also with us being a company that's been so involved in the community, like, we want to make sure that we're also addressing other aspects of non-physio related community things that could potentially help. And we've got quite a large population of homeless and addicts and food banks and so on. So we're working probably towards doing some sort of social, more community-driven thing, keeping in mind the social distancing and so on. But whether it's by donation or coming together in that sort of way, we're not only thinking of ourselves, but for the community as well.
Man, I say screw it, Vinny. I want to give you a virtual hug right now. That's soul food, man. I would send all my clients a stay well postcard and then see you on April 1st or whenever their appointment was. I'd go old school. I know everyone's talking about telehealth and can we bill for it, and we should use it for rapport building and all that stuff. I do want to save some time for these individual, there's a lot of individual clinicians. I want to throw it over to Daryl Yardley. Daryl, if you're one of these clinicians that are sitting on this side of the screen, trying to do telehealth, trying to connect with their clients, or they're in front of their patient, they're the select physio that's in the skeleton team, what do they do to manage this situation?
So I'll talk. What I'll do is I'll share, because I don't want to give you just necessarily my opinion, but I'll say what I'm sharing with the group of clinicians that I'm mentoring over the last little bit. My biggest piece of advice to them is to partner with their owners. So going up against your owner to say, I can do this differently, or I can do better myself, or I'm not going to come in because I'm an employee or a contractor, blah, blah, blah. The reality is then we're not actually working together. So if we all want to put our hashtags out and say that we're better together, stronger together, we actually have to partner with our owners, and together, I think what Men's doing, and what Vinny's doing and what Wendy's talked about, we're all collaborating and partnering with our staff. So if that's not happening at your practice, my biggest piece of advice to you is make it happen. And even if it has to be done virtually, you guys have to make that happen. This is a time where we can't be me versus my owner like I may have been in the past as a, for how people have seen me in maybe some workshop videos being like that too cool clinician. There's no time for that anymore. This is us collaborating together. We're essential service providers, and the best way that we can get our services out and expand them, especially as the dust settles and we actually come out on top, in order for us to rebound, because this is a great opportunity despite how problematic it is right now, partner with your owner and you will have good things that will come in the near future.
So just this is the chat and the question and answer is going viral because you had mentioned that you've been doing telerehab for a year now, and a lot of questions around which insurance companies are covering for this. What's your experience on that?
So yeah, so for me, a lot of the patients that I see, unfortunately, they come to me and they don't have insurance anymore. So I don't usually run into as many challenges because people just pay out of pocket. However, there is insurance that will cover it. We know in Ontario, WSAB will cover it. There's codes that are suitable enough that the motor vehicle insurance will accept it as well. The challenge, of course, though, is, what will the insurer look at it if it's not covered? But again, it's a physiotherapy service. And if you look, I can only comment from Ontario. The guideline states that on my invoice, I need to actually identify that it's virtual. So right now, our company, we need to, and all of us on this phone call, especially at the clinic, we need to make decisions quickly in a time of crisis like this. So our position moving forward, we know that some will get covered. We're going to be very transparent with it, and some won't get covered, but that's going to be our decision on the end, that I will decide that I will end up probably eating that as a pro bono fee, because that's what I want to be able to do to get this patient through their recovery plan. And in order to get them through their journey, I'm going to need to do that. And that's how I'm going to come back to a full caseload.
That's awesome. And so do you structure, there's a lot of questions in terms of structuring your time on these telehealth sessions. Is it a 20-minute session, 50 minutes, half an hour? What are you doing there?
Yeah, so it's the same thing as sort of how the clinic, so 30-minute follow-up, and it's all my follow-ups that are going into telerehab right now. And if I did initial, and I will do a discovery visit for people if they're like, oh, I was referred to you, but I don't know what you do. That's a 15-minute pro bono session. I actually prefer to do that than over the phone, because I can get a better judge of character and how that individual will fit with me. If I can see you, just like I can see our 5 panelists, I can tell who's more engaged, who's less engaged, who's cooler, like Vinny out west, those sorts of things. So that's just how I do it, but I do it as a pro bono.
Cool. I know we're coming close to that hour, and I'm respecting everyone's time. And Nicole, if she talks for a second, she's truly living the entrepreneurial, physio by day, mom by night. She's got this little cutie patootie there. Nicole, if there's one takeaway from this crisis that you can share and inspire everyone else, one takeaway, what would that be? Either one of you can talk.
Public health and population health first. That's what I have to say. However you want to interpret that, we got to be good global citizens.
Perfect. Now, Wendy, what's your number one takeaway that you can give and inspire someone on this call?
Other than wash your hands, are you guys sick of hearing that yet? Is plan ahead. April 1 is just a number, and this does not end then. You have to think beyond that and plan for prolonged closure if that happens.
Awesome. Daryl Yardley, tell us what's your number one takeaway to get to everyone today.
So I would say, we can certainly meet all guidelines and be socially distanced, but remain on the offense, even if you're suspending inpatient care or in-person care.
Thank you. Perfect. Vinny Rehab, tell us what's your takeaway from the West Coast?
I would say it's going to go beyond April 1st in terms of the timeline. So we all need to be ready. We all need to be prepared to redefine ourselves, our practices, our clinic, and perhaps the scope of physiotherapy moving forward.
Yeah, and I think that's well said, man. This is a pivotal time. I think everyone talks about this, like, when does the spike come up, this inflection point? And I truly feel this is the inflection point for physical therapy. All of us have made tough decisions, whether to stay open, to stay closed, to do a hybrid model. There is no right or wrong to any of that. I think it comes down to a personal decision. and what your mighty why is and what drives you to go to the clinic and come home and take care of that little bundle of joy up there. And I really appreciate, and I said this at the beginning, is this webinar happened within 30 minutes. And these guys, these panelists that are above here, care so much about the profession. And I know that this profession cares about itself because I can see it on all the social channels. I really want to thank the CPA for allowing us to do, you know, a little bit of a takeover party. And I really hope that everyone has gained some information. I know there was a lot of questions about extended healthcare. Does it cover it? They're doing another tele-rehab session on the CPA's COVID-19 website. You can take a look. It's later this week. From the information that I've gathered, at this present, it's not. But I just talked to JP, our CEO, an amazing guy who assured us that this is going to be on one of our strategic objectives to get virtual consultation covered across the board. So it is on the CPA mandate. So I just wanted to thank everybody, Nicole, Wendy, Daryl, Vinny. Thank you for everyone for sticking in with us. Vinny, if someone wants to talk to you, how do they connect with you? What's the best way to connect with you?
Well, I'm on Instagram as Vinny Rehab, not the Vinny IE Rehab, which some of you may have come to see. Also, my actual email address is vinnyrehab@gmail.com to reach out.
All right, vinnyrehab@gmail.com, Vinny Rehab, the OJ on IG. Daryl Yardley, how do we find you?
Yeah, you know what? If anyone has any follow-up questions too that we didn't get to with my name on it, just message me on Instagram at Daryl Yardley. That'll be the easiest.
Awesome. And Wendy, can people reach out to you? You're a busy girl.
I like email, wcoombs@momentumhealth.ca, and I'll get back to you.
Awesome. Thank you, Wendy, for joining us. Nicole, the Trailblazer. How do we find you if people have questions and how to continue being a Trailblazer?
Mend Physio Nicole on Instagram, or you can just go to our Mend Physio page, and then nicole.sullivan@mendphysio.ca.
Awesome. Thank you, all
Kareem.
the panelists.
Hey, just want to say thanks to you as PPD chair. Thanks for pulling this together and outdoing any webinar I've ever done. So you're the man. Thanks for doing this.
Thanks
for the invite.
Thanks everybody.
Guys. And if you need to contact us, we're at CPA Private Practice on Instagram or at Physio Kareem on Instagram. Thank you, everyone. Thank you. And